Finally, vitamin E also acts in synergy with other vitamins, such as vitamin C and A, strengthening the immune system and reducing the risk of infections that could worsen esophageal inflammation. This vitamin is, therefore, a powerful ally for digestive health, helping not only to alleviate symptoms, but also to prevent the progression of problems associated with reflux. Vitamin B12. Vitamin B12 is essential for digestive health and especially for the maintenance of the gastric mucosa. This nutrient directly contributes to the protection and regeneration of the stomach lining, preventing inflammation and discomfort that, when left untreated, can worsen the symptoms of gastroesophageal reflux. In people with vitamin B12 deficiency, the risk of developing gastric inflammation and digestive problems increases significantly as the gastric mucosa becomes more vulnerable to attack by acids and digestive enzymes. Vitamin B12 plays an essential role in cell production and renewal, a critical process for the integrity of the gastric mucosa. The mucosa, which is the inner lining of the stomach, is constantly exposed to gastric acid. To stay healthy, it depends on efficient cell renewal, and vitamin B12 directly contributes to this. By stimulating the creation of new cells, the vitamin helps repair any wear and tear that occurs naturally, making the mucosa more resistant to irritation caused by acid. This way, the risk of inflammation and discomfort is reduced, which alleviates reflux symptoms and prevents their progression. Furthermore, vitamin B12 contributes to the production of immunological factors that protect the gastrointestinal tract against infections and inflammation. Vitamin B12 deficiency is associated with a decrease in local immunity, making the gastric mucosa more susceptible to bacterial infections, such as the bacteria Helicobacter pylori. This bacteria is known to damage the stomach lining, worsening reflux symptoms, and can cause chronic gastritis. With adequate levels of vitamin B12, the immune system acts more effectively to protect the mucosa, preventing infections from worsening digestive conditions. Another important aspect is the role of vitamin B12 in the production of substances that balance stomach pH. It helps in the synthesis of enzymes and other digestive substances that regulate stomach acidity, contributing to a less aggressive environment. This pH regulation is particularly beneficial for those suffering from reflux, as it helps to reduce the amount of acid that can return to the esophagus, reducing irritation and burning sensations. Finally, people who use acid inhibitors, medications commonly prescribed to treat reflux, are at risk of developing vitamin B12 deficiency. These medications reduce stomach acidity, which makes it difficult to absorb vitamin B12 present in food. Therefore, maintaining adequate levels of vitamin B12 is crucial to preserving gastric health and preventing reflux treatment from causing other digestive problems. Combining support for cell regeneration, immune protection, and regulation of the stomach's acidic environment, vitamin B12 is an essential ally for keeping the gastric mucosa healthy and resistant, preventing discomfort, and reducing the impact of reflux symptoms on a daily basis. Including these vitamins in your routine can make all the difference in your quality of life. Remember, always consult a doctor to adjust your diet and supplements correctly. Did you like these tips? Subscribe to the channel, leave your like, and share with whoever you think needs to know this. Hello, welcome to our channel. Have you ever felt that burning sensation in your chest or the famous reflux right after eating? The discomfort can be constant and disrupt your routine. But did you know that some vitamins can help combat this problem naturally? Today, we're going to talk about 4 vitamins that can be your allies against reflux and bring you the relief you're looking for. Vitamin D. Vitamin D is a powerful ally for digestive health and plays an essential role in balancing our immune system and reducing inflammation in the stomach, which in turn can alleviate the symptoms of gastroesophageal reflux. Many people do not associate this vitamin with digestion, but its influence is fundamental. Firstly, vitamin D acts as a regulator of the immune system, strengthening our natural defenses and protecting the gastrointestinal tract from bacteria and pathogens. This protection is especially relevant for those who suffer from reflux, as infections and inflammation in the esophagus and stomach can worsen the symptoms of the disease. By keeping the immune system stronger, vitamin D helps the body fight inflammation more efficiently, helping with recovery and preventing the worsening of digestive problems. Additionally, Vitamin D regulates the production of anti-inflammatory proteins, which fight inflammation in the walls of the stomach and esophagus. This is particularly important for those who face constant irritation from stomach acid, a common symptom of reflux. With less inflammation, the discomfort and damage caused by reflux may decrease. Finally, good digestive health depends on several factors, and vitamin D also participates in the absorption of important nutrients for the functioning of the gastrointestinal tract. Vitamin C. Vitamin C is widely recognized for its antioxidant properties, but its role goes beyond fighting free radicals. It also contributes to the acid balance of the stomach, promoting a healthier environment and helping to protect irritated mucous membranes. This vitamin is particularly useful for those facing digestive problems, as it helps regulate the pH of the stomach, making it less acidic in situations where there is constant irritation, such as in cases of gastritis and reflux. One of the most important effects of vitamin C is to stimulate the healing process of irritated tissues. When the mucosa of the stomach or esophagus is inflamed or damaged by frequent contact with gastric acid, vitamin C acts on the regenerative process, accelerating the recovery of mucosal cells and reducing the discomfort associated with these conditions. This occurs because vitamin C stimulates the production of collagen, a protein essential for the repair and maintenance of cells. With more collagen, the mucosa gains resistance and can heal more effectively, reducing the time needed for recovery and minimizing exposure to further damage. Furthermore, vitamin C acts directly in maintaining the immune system, making the body more resistant against gastrointestinal infections. Many of these infections, such as those caused by the bacteria H. pylori, affect the stomach and can aggravate or trigger symptoms of digestive problems. By strengthening the immune system, vitamin C contributes to extra protection against these invading agents, preventing the mucosa from being further damaged. Another important point is that vitamin C helps in the absorption of iron, a fundamental mineral for blood health and for transporting oxygen to cells, including those in the digestive system. This oxygen transport is essential to keep the gastrointestinal tract healthy and to support the healing and cell renewal process. Vitamin E. Vitamin E is widely valued for its anti-inflammatory and antioxidant properties, and this combination makes it essential in protecting the esophagus, especially in people suffering from gastroesophageal reflux. By protecting cells against oxidative and inflammatory damage, vitamin E creates a barrier against the harmful effects of gastric acid, which often irritates and wears down the esophageal lining, causing discomfort, heartburn, and even cell damage. The main action of vitamin E is to reduce inflammation in the lining of the esophagus. In cases of reflux, stomach acid often reaches the esophagus, leading to an inflammatory process that, over time, can cause permanent tissue damage. Vitamin E helps inhibit inflammatory reactions, which reduces swelling and discomfort, as well as preventing the worsening of digestive and respiratory problems associated with reflux. This happens because vitamin E regulates inflammatory cytokines, molecules that the body releases in response to irritation and which are responsible for increased inflammation in affected tissues. Another important benefit of vitamin E is its antioxidant action. Antioxidants protect cells against damage from free radicals, which are unstable particles generated by oxidative stress, a common process in inflamed and injured areas. In the case of the esophagus, vitamin E neutralizes these free radicals, helping to prevent cell degeneration and supporting the regeneration of esophageal tissue. This antioxidant effect helps the esophagus recover more quickly and healthily, reducing the likelihood of new injuries due to continuous contact with gastric acid. Furthermore, vitamin E also contributes to the production and maintenance of healthy cells, making the esophageal wall more resistant to acid. When combined with a balanced diet and, if necessary, other supplements, vitamin E can help create a natural protective barrier for the esophagus. This support for cellular tissue is essential for those suffering from chronic reflux, as the esophagus becomes more resistant to irritation and better able to maintain its structural integrity.